church team. We're hosting the webinars together with James Henderson and team from the Transforming Communities Together and Horda, and the wider public health, communications and community development teams within Dudley Council. Just some background information. The seminars are based on a model from the ASH Foundation, that's the Aberdeen Street Church and Health Foundation, along with Birmingham Community Trust, delivering health seminars in May. A collaborative approach and model of sharing expertise in support of the community. So we are building on this model where faith and non-faith groups can work alongside the local authority, NHS and voluntary organisations to provide a platform to share important information to the community, especially at this time around the pandemic. So just a little bit of further information, community groups, you know, we are mobilised to work with health and care professionals, responding to concerns about the coronavirus, including public health, physical health and mental health conditions, and also socio-economic factors, including health inequalities and wider inequalities, and looking at solutions together. So these seminars, we're going to be providing important and supportive information. We're going to be sharing information from the current public health reports and local data. We're thinking about managing physical and mental health post-lockdown. And we're sharing what support is in place and signposting where people can go for further information. And this will be based on a local, regional and national guidance. So each week we'll have a variety of speakers from the medical, nursing and wider health and social care, voluntary and independent sectors. This is from the Dudley Borough, from the Black Country footprint and the wider West Midlands. Hopefully we can have the Zoom etiquette slide. We'll see if that can come up. If not, I'll just speak to that. I think it's coming. And I hope everyone enjoyed the silence. That was intentional this week, but we'll have some lovely music for you next week. So I'll just quickly go through the Zoom etiquette before we go to our first speaker. As it says there, please ensure that your device reflects your name, and we're asking, and that's either your first name or your obviously your last name. Please ensure that your video remains off and your audio muted at all times unless you're asked to speak. And obviously we're asking that because that helps to improve with the actual Zoom recording. So if you can bear with us for that. You will have the opportunity to ask questions via the chat facility, and we're asking if you can put that in capitals so that the questions will stand out, because we've got at least 80 people on the meeting this evening. We're expecting possibly 150, and we really want to capture those questions. My colleagues Anne Horder and James Henderson will be facilitating those questions to our panel members, our guest speakers, and also our speakers, where possible, will actually respond to those questions directly on the chat. I just wanted to say quickly as well that Dudley Council have provided an email address for continued feedback and questions if there's anything that we're unable to cover tonight or as we go along for the next 5 weeks. And this email address will be available for 1 month post-event, and your feedback will go back to the wider evaluation. And we will put that information for you, but it's healthycommunities@dudley.gov.uk. Also, as we can see there, you know, the information highway is moving so quickly, but the content of the webinars is accurate at the time of presentation, but please always refer to any updated versions of guidance that's going to be provided. Also to let you know that at the end of the session at 8:30, we'll have a short meet and greet for around 10 minutes. And for those that prefer, you can put your videos on at this point and meet and greet the community. We know that there's a variety of people that have joined us this evening. We really want to thank you. We want to also let you know that the seminars will be recorded and shared on the Cornerstone Community Church website, and the details are there. So we really want to thank you for joining us this evening. We know that whilst this is organised by Dudley, we have, as I say, I know we have family, friends, colleagues, people from, the wider Black Country footprint, the West Midlands. I can see there was someone there from London. So it's really great, the mix of people tonight. So our speakers tonight are Balcour, Dr. Urban Ghani, Claudia Oliveira, and Shaz Akhtar. And at this time, I'll hand over to our first speaker, Balcour. Thank you. Over to you, Bal.
Okay, hopefully you can hear me.
Yes, we can.
Okay, thank you. Okay, I'm Balcour. I'm Acting Director of Public Health for Dudley, and I started my job on the 1st of April. Yes, it was right in the middle of the current crisis. So it was somewhere after the first case in Dudley and the start of the lockdown. So it has really been a baptism of fire for me. I have to say I'm very fond of Dudley, not only because I work here, but also my very early childhood was spent here. My family settled in Dudley, and I now sort of have family all across the Black Country. So today I'm actually speaking to you from my home in Walsall. So I just wanted to start off by saying that, for me, as the whole situation with COVID-19 unfolded, I found this both personally and professionally challenging, like probably a lot of us did. It has been such an unprecedented time, and it's not only been, the fact that we've been a region outside of Dudley to have our first cases, and we saw our first peak, but it also became very evident, sort of as the virus continued, the impact it was having on our Black, Asian and minority ethnic communities, and that there were greater risk factors. We didn't really know what that was, and we are starting to get a bit of an understanding of that. But as you can imagine, similar to yourselves, it was a concern for myself, both from as being responsible for the population of Dudley, but also in terms of my own family, and wider friends and colleagues, etc. So I'm so pleased that we've been able to get to this point, and that we're sharing these series of seminars with you, and towards the end of my presentation I'll share with you some of the things we are going to be doing and started to do to work with our communities to try and address and mitigate some of the issues and factors around COVID-19. So public health do work, we do work across a whole range of settings, but our response in this case has really been to help delay the spread of COVID, and we've done everything we can to try to protect some of our most vulnerable from the impacts of COVID, and we've also have a big role to play in reducing the impact it has on the wider health and social care system, and obviously our communities and the local economy. So I'm going to start off by just giving you a little bit of information and data on the current situation in Dudley. So if we can move to the first slide, please. And as Jackie has said, this data is changing all the time. So you might find, that the most up-to-date data is available online, but this is going to be still lagging behind a bit. Great, thank you. This is just to give you a bit of an overview of the situation in Dudley, as you can see, considering we were the very first, one of the first in the region to get our first case, over the last few months, our position has changed quite significantly. We are now that this data is based on a single set of data that we get, a single set of testing data, and we are 7th in the region. However, more recently we've managed to get some additional data, and that's moved us further down the ranking. So we're sort of roughly around 10th in the region in terms of cases to date in Dudley. What I also want to say to you is that I know there's been a lot of concern about the situation in Leicester. And just so that you can get a better understanding of what some of where we are in relation to Leicester, their current 7-day rates, daily rates, are the weekly rates are 135 per 100,000, and for us in Dudley it's 1.9 per 100,000. So we're roughly saying that we're getting about 1 case a day. So as you can see, the situation significantly eased in Dudley in comparison to some of our neighbouring areas, and significantly less and then what the situation is in Leicester. Do you want to move to the next slide, please? So before I sort of start talking around this data, I do want to just acknowledge the fact that we obviously use the data to help us get an understanding of the situation, but I really want to pay my respects to all of we are all touched by people, or know of people or families that have been touched by sadly the passing away of members of our community. So just want to pay my respects to that, and to all family and friends that have lost loved ones. As you can see, in terms of the deaths in Dudley, we have been slightly lower than other areas, and again we know that the data is difficult to see in the graph, but we have been lower than our neighbouring areas, but sadly we still have had a number of deaths, and every death is obviously something that we don't want, and I'm glad to say over the last last few weeks, our deaths in relation to COVID have reduced significantly. In fact, we've probably not had any for the last several days. If you can move on to the next one, please. So this data shows when the peak was for us in Dudley in terms of deaths, and it was around the start of April. A majority of our deaths were in hospitals, which showed, which shows the fact that they were in very vulnerable individuals. The next highest number of deaths were in care homes, again, indicating the vulnerability of some of our more older population, and then we've got smaller numbers that were in other settings. Next slide, please. This slide gives you a little bit of information on our care homes in Dudley. We have 95 registered with CQC, and we've up to the 1st of I can't see that date there, but we have tested all of our residents so far now, so that is out of date. But we have all of our residents have been tested for COVID, and we've had 243 that tested positive. There have been 67 deaths that have been attributed to COVID, and at its peak, 18 care homes in Dudley had care outbreaks, and that was 7th of May. We are in a very fortunate situation that we've been able to keep 60% of our care homes COVID free, and to date we've only got 1 care home now that is currently experiencing an outbreak. We are testing all of our residents, and that has significantly helped us in managing and preventing further cases and outbreaks arising. So our story compared to the rest of the UK and other areas has been a positive one. Next slide, please. And this again is just a very quick overview of when we peaked and what the deaths are looking like across in our hospital setting. I just want to say at this point, some of our data may not be similar in all of the slides, because some of our data covers deaths that are actually residents in Dudley, and some of our deaths will be in a hospital setting, and those deaths will also count residents that are outside of the Dudley Borough. Next slide, please. So this graph plots the deaths that have been registered, and the data is available on ONS. So the deaths in Dudley have been fairly evenly distributed across the borough, and where you on this map maybe see where it looks like there might be higher numbers is primarily due to care home factors. So we have got care homes that are also sort of deaths that are covered on the map, but if we then sort of remove those, we'll find that actually there's no significant sort of differences in deaths across the borough, again, unlike maybe some other areas where there's been more clusters in particular wards or pockets. Next slide, please. And then this slide sort of collates those deaths by ward. And again, we know from our data that the variation of deaths is very similar. And again, the ones that have probably got the higher deaths are where our care homes are. So there's not been really any significant difference in deaths. And we do appreciate the fact that we need to probably go further into that data and sort of scrutinise it more. But you know, again, you know, we don't feel that there's been any particular areas or wards that have significantly higher deaths at all. Next slide, please. And then this was the COVID-19 symptom app that that was launched very early on in the COVID situation, and this we encouraged our residents to sign up to it, because it was around sort of registering symptoms themselves, and this is contributed to national research, and we're hoping once we've got through this, we'll be able to gather the data behind this app. And what's been really good about this app is that it's also sort of responded to the changing sort of situation. And so, for example, when we started to recognise that there were potential issues and the situation with COVID was impacting on our Black and Asian minority ethnic communities, the app did request for ethnicity data, and we all know that that has been a challenge. So again, hopefully this will help us in sort of understanding some of the patterns once we get hold of the data behind it. Next slide, please. Okay, so I think I want to just sort of summarize really is, so one of the challenges we have had is that you know, getting access to data around Black and Asian minority ethnic groups has been difficult, and we all know that as the situation began to materialise, that there seemed to be a higher impact on Black and minority ethnic communities. The national research was undertaken, and we know from that findings, Kevin Fenton's report identified several areas that we really need to be progressively working on to get a better understanding of what the impact of COVID has been. So the first one obviously on there is ethnicity data collection and recording, and we're very conscious of that, the fact that, you know, that is very poor, and we need to actually do more around that issue. And then the remainder of the findings again are something that we've really taken on board in Dudley, and I just want to sort of stress the point that we have been working in sort of community participatory ways already in Dudley. We have got a very strong community engagement approach, and hence why we are where we are today in terms of having this dialogue, having these seminars. But I just wanted to say that it's really important that as a local authority we really recognise and value the fact that we need to respond to the findings of the national research and data, but also to highlight some of the work that we are going to be doing in responding to the situation. Next slide, please. So in terms of the work we're doing in Dudley, we have now, we recognise that in order to really address and work with our Black and Asian minority ethnic communities, it needs to be a real system-wide approach. So we have set up a subgroup under our Dudley Health and Wellbeing Board, and this is really going to enable us to have that wider system-wide focus. We have our hospital trust sits on that group, wider health and social care partners sit on that group. We also have our voluntary community sector represented there. So what we really want to do is use both a range of data and information, but a whole raft of community engagement approaches to really start to understand what the needs are of our population in Dudley. We recognise that there's three ways we're going to do this. There's a bit about what we need to do as services. There's something about our responsibility, but there's also something about how we work with you as a community, that this is really about a collaborative approach, and we really need to do, there's a lot of things that we need to do collectively, but we also recognise that as a community, sometimes communities know far more than what we know, and so therefore we really want to empower and work with communities to take some leadership as well. So we really, that is really some of the principles behind the work that we want to do. So very early on, we really did engage, we did everything we could to engage with our wider community, translating information, using different engagement approaches to get the messages of COVID-19 out. We also made sure that when we were supporting our shielded population, that we were considerate of cultural needs. So we weren't just providing standard food packages, we were actually providing food packages that met the needs of different population groups. We're undertaking a survey, a population survey, which will also capture ethnicity data. We know that during this time, there's been a lot of interest from other areas. Our populations are really wanting to engage, so that will really help us. We're also commissioning a special school survey around COVID-19, and again that will help us understand some of the needs and issues within our child and young people's population, and again that will also help us capture some of the ethnicity data behind there. We're working across the system around undertaking a mortality review. Again, that will give us some understanding of the demographics of the population. And we'll also start to review our public health programs and things like our health check program that really is sort of helping us, which is a real important program that helps us understand what some of the higher risk issues are within our population. For example, heart disease, diabetes, kidney and heart stroke disease. So we really need to be able to understand and reach communities with some of these checks, so we can identify problems before they occur. And then we're also working with a range of our commissioning providers and commissioning services to ensure that our services are culturally competent and reaching a diverse group of people. And with it from the local authority perspective, we have put in place risk assessments that specifically identifying our Black and Asian minority ethnic employees, and we are also ensuring that our Black and Asian minority ethnic communities are also a priority group in our Test and Trace programme, which I'm going to now move on to. Dr. Irfan Ghani is leading on this on our behalf, and he's going to go into more detail on it. So thank you for your time.
Hi, can we just unmute Dr. Ghani, please, as soon as possible? Thank you.
Thank you. Good evening, everyone. My name is Dr. Irfan Ghani, and I work in public health team. I also started working, it was mid of April, and I'm supporting Bell and the team on two main things. One's providing public health advice and guidance to schools, especially as they are reopening. And also I'm leading on work for NHS Test and Trace, which is one of the key aspects of our next phase of our recovery plans. So it's really, really good to see that so many people are here. So we want to discuss about the background to the program, of what we are doing in Dudley locally and how we can work together so that we can support our fight against the pandemic. So can I have the slides, please? Thank you. The next slide, please. The UK government launched its contact tracing service on 28th of May. And the aim of the service is to reduce the spread of the disease, save lives, and then help our society to return to as normal as possible in a safe way, and not only protect our health and care system, but also protect our economy. This is going to be a system-wide response, and all of us will need to work together with our communities in order to ensure that this is a successful program. Can you hear? Can you hear me better now?
Yes, thank you, Dr. Ghani, that helps.
Okay, thank you. Next slide, please. So the key aspect of that test and trace is that as soon as anyone has symptoms of coronavirus, and there are three symptoms: high temperature, which means feeling hot to touch on chest or back, a new continuous cough, or lost or change to sense of smell or taste. The individual must self-isolate for at least 7 days. And that's really, really important, because we need to ensure that we are protecting others, our loved ones, or our friends, our family, from this disease. In addition to self-isolating, who's experiencing the symptoms, anybody who lives in the household also must self-isolate for 14 days from the day you've started having symptoms. This is to ensure that if the disease has been spread, so we can protect our wider community. So the first step is self-isolation. Next slide, please. The next one is to get tested in order to confirm whether one has coronavirus or not. And it's very easy to get the test. There are two ways we can order tests. One is to go on the NHS website, or if we do not have access to NHS website, we can call 119. And there are two ways we can get tested. We can go to one of the testing units and get tested. It's a drive-through center, and it's very easy at the moment to get the appointments there. Or if we cannot go to testing unit, we then order a postal kit. So it will be couriered to home. We take the test. It's very simple to take the swab, and then it will be couriered back to do that. So it's really, really important that after self-isolation, we order a test. At this time, you may want to alert the people who you had a close contact over the last 48 hours, just to let them know that you might have symptoms, and so that they are aware of that in case they develop symptoms, and they can self-isolate themselves. Next slide, please. So the results are coming back quickly. So if you go to the testing unit, the result will be back in less than 48 hours. And if it's through the poster kit, it usually takes 72 hours. The important thing here to be mindful of is that the test must be done within 5 days of developing the symptoms. If anyone doesn't get the results back, they can contact this contact center on 119, and they can help them. So there are 3 result outcomes. First, if it's negative, that means you do not have coronavirus. The members of your household can stop self-isolating, and if you had symptoms and you are feeling well, you can stop self-isolating as well. Next slide, please. And if you have a positive result, means that you have coronavirus, you must self-isolate for at least 7 days from when your symptoms started. It's really, really important to stop spreading the disease. In addition, your household also self-isolate from 14 days from when you started self-isolating. You will be contacted by NHS Test and Trace service, and they will ask you to share the information about your close contacts. So then they can contact your contacts and advise them to self-isolate for 14 days. It can be done, it's done anonymously. They don't share the information. It's a very confidential service, but it's really important that we do contact any close contact, and they can self-isolate themselves. Next slide, please. Sadly, we are aware that there are some scams going on. We have already given out some information, but the key things here to remember is that the results or the messages will come from NHS tracing or from a phone number which we have put in. It would not come from any other source. It's going to come either from NHS tracing or the from number, and they will ask you to sign into a website, which is an NHS Test and Trace website, so that you can provide the details regarding the contacts. They will never ask you to dial a premium number, so 0900 or 0745 or 0845. They will never ask you to make a payment or ask for any password details or bank accounts, or to do that, or ask you to hand over the control of your tablet or smartphone by downloading a software. They will also not disclose any of your personal medical information to your contacts. It's a really important message we need to give to community so that there's no frauds, and we are going to keep reminding everybody about this. Next slide, please. So who are the close contacts which will be asked to self-isolate for confirmed cases? It will be any family members or household members who are living with a confirmed case, or any other contact 48 hours before the development of symptoms and the time since the symptoms. So if we have face-to-face contact with somebody, which less than 1 meter, or if we have spent more than 15 minutes within 2 meters of somebody. If you have traveled in a car or another small vehicle with somebody, or or if we were close to them on a plane, or if we have recently visited or work in another setting like GPs or a school or a workplace. So we are already doing a lot of work with our schools because, as you might be aware, that in the schools some years are back and they are in a bubbles of 15 pupils. So if anybody will get symptoms, we provide them advice, and Public Health England gets involved in it and to do a thorough risk assessment to ensure that we give advice, appropriate advice to the cases, and if they're tested positive, then we give advice to their close contacts. Next slide, please. This is just a slide, and you might have seen that, basically just summarizing what I've said. Anybody who has symptoms, they must self-isolate, their household must self-isolate, book a test. If negative, self-isolation can stop. If positive, the NHS Test and Trace will contact them for and ask them about their contacts. The contacts will be asked to self-isolate for 14 days. The contacts do not need to test. They will only need to test if they develop symptoms. All the confirmed cases or contacts will be contacted at least 3 times or 3 attempts. And if there are no contact, then there won't be no contact. We are trying to see how we can ensure that everyone who needs to be contacted, we get their information and give them advice, because it's as I said, it's really, really important that everybody needs to be self-isolating. Next slide. So now what we are doing to support the National Test and Trace program. As part of this program, all the local authorities were required to produce local outbreak control plans and to publish them by Tuesday, which we have done. It is available on our council website. It outlines how we are going to respond and how we are going to support different elements of test and trace program. So it's available to everybody who wants to read it. But at the same time, what I want to mention is that we are not starting from scratch. We are already working with our partners, with you guys, with lots of communities for some time to support our communities in response to outbreaks. So Val already mentioned about care homes and the fantastic work we have done. Schools, we are doing a lot of work with schools to support schools in reopening and then provide advice if there are any cases. And I'm really happy to tell you that since the school have opened, we have had no confirmed cases in staff or pupils. So that shows exact how much hard work has gone into schools reopening, that they are providing excellent support to parents and to staff and to pupils. Just an infographics to show what I've been doing. So we have contacted a lot of members of public who have been shielding, providing them food passes, providing them medications, providing advice, providing PPE where it's required, and the access to our websites have increased by 160%. So what we are doing is we are building on the work we have done. Next slide, please. We've already covered that. Next slide, please. And the next slide, I've already covered that. This is just to give you an overview of our outbreak control plan, what our objectives, but this is available on online. I think a couple of things I want to mention is that our plans are not focused on response, but it's also prevention is at the forefront of everything. We would like to work with you to see how we can work with communities to support them as the lockdown is easing and provide them guidance so we can ensure that we do not see more cases and we do not see the situation which has happened in Leicester. And we can only do if we all work together. And I know we are already have done a lot of work together, so it's just built on that. We have developed a few subgroups for different settings. So there's subgroups from communities, for our vulnerable groups, for our schools, for our care homes, who are working with and linking with existing partnerships and providing guidance and preventive measures to these groups. We are going to do a huge engagement exercise within Dudley so that we can build trust and confidence and improve participation in compliance in our community. Next slide, please. This is just to give you an example of what we have been doing and what kind of support is available. So our community development workers have been in touch with a number of our communities and sharing information. Also, we have worked so that we have guidance in different languages and we're providing support and responding to queries. A number of helplines which are available. And this information is available on our website. So please do visit our website where you can find all this information and how to signpost the community to relevant services. Next slide, please. Just a last thing to say, how we can work together, I think is sending the key messages about self-isolation, about importance of getting tested if anyone has symptoms. There is a lot of support available. So if you have any questions, you have any queries, or if you want to raise any concerns, please contact us on that Healthy Communities email across. Please let us know if you are coming across any concerns from people in your community. We are here to help you, and we will like to address any concerns, any anxiety, any worries. You might have seen there's a lot of incorrect information in the media. So we want to actually dispel all these myths and provide the right information, because we have done a lot of work and our numbers are very low. So there isn't need to worry, and we want to ensure that there's no false information. So if any concerns, please contact us, and please visit our websites. There are 2 websites which we put information. There's a lot of information on how we can get support during this period, and also our plans are also on this website. Thank you, everyone. I'm going to hand it over to my colleague, Claudia, who's going to provide some key public health protection messages. Thank you.
Hi, everybody.
Hi, Claudia. That's great. We can hear you.
Oh, lovely.
Please go ahead.
I'll just wait for the presentation. So my name is Claudia Pinto de Oliveira. I'm one of the health protection nurses with the health protection team with Dudley Council. And I will be talking to you about some infection control precautions and principles. So yeah, if you have any questions, just type them on the chat, and I'll answer them as best I can after, or some of my colleagues might. So if I could have the next slide, please. Could I just have the next slide, please? Oh. Oh, lovely. Thank you very much. So coronaviruses, just a quick introduction. They're a large family of viruses, and some cause less severe disease like the common cold, but some do cause, so this family of viruses, some cause more severe disease like the Middle East Respiratory Syndrome, which you might have heard of in the news, the MERS, and severe acute respiratory syndrome, which is SARS, and SARS-CoV-2, which is the virus that causes the disease COVID-19, because it's a brand new virus and there's no known population immunity. So none of us has immunity to this disease. And that's why all of us are potentially susceptible to this disease. Could I have the next slide, please? So the case definition, and Dr. Kani already covered some of this, so I do apologize if it's a bit repetitive. So a confirmed case is somebody who's had the test and they tested positive. They may or may not have symptoms. A possible case is somebody who has symptoms of COVID-19, so it could be a new continuous cough or a high temperature, and or a loss of or change in your normal sense of taste or smell. Could I have the next slide, please? So most people have no obvious symptoms, between 30 and 40%, and most children will get mild disease. The more severe disease is in the elderly, so the vulnerable groups, which is why they had special precautions advised to them. People with diabetes, people with heart disease. So these are just some examples. It's not an exhaustive list. Chronic respiratory disease, somebody who's immunocompromised. And less than 2% of cases are fatal, and they are highest, unfortunately, in the high-risk groups. Next slide, please. So the incubation period, so that's the time between when you've been exposed to the virus until you actually develop symptoms, is between 1 and 14 days, but it's on average 5 days. Next slide, please. So the infectious period, so when somebody's thought to be infectious, and as we said at the beginning, it keeps changing this information. So as time progresses, we will know more about this virus. So a person is thought to be infectious 48 hours before the symptoms appear, and that's why the NHS Test and Trace asks about who you had contact before your symptoms appeared, and up to 7 days after you start showing symptoms of COVID-19. Next slide, please. So how is it transmitted? So you can catch COVID-19 if you're exposed to respiratory droplets. So if somebody coughs or sneezes, these droplets, you know, if you've been exposed to these when you've been close to somebody who is, for example, coughing, and it can survive on surfaces, but it is thought that it reduces dramatically after 72 hours, but it may last up to 9 days on hard surfaces. Again, studies are ongoing, and we will know more about how long the virus lasts on surfaces. However, The virus is easily inactivated on surfaces if you use a bleach containing solution, obviously where appropriate, and always follow the manufacturer's instructions and guidance, and in the right dilution, etc. So just that caveat. And your standard detergents for cleaning. And on your hands, it's easily inactivated, but when you wash with soap and water and then you dry your hands, or if you don't have access to you know, if you can't do hand hygiene in a hand washing sink, you can use an alcohol-based gel, but it has to have at least 60% alcohol, which most of them do. You know, if you have any queries about this, obviously anything what I'm saying, you know, feel free to email us questions at the email provided. I'll speak a bit more about this in a little bit. Next slide, please. So we are in a period of sustained transmission, and you might have heard this in the news. What it means is just that at the moment, COVID-19 is affecting many people in the community, and they may not all have had that obvious contact with somebody who has symptoms of the infection. So that's what the sustained transmission term means. Could I have the next one, please? So these are some infographics, some images from the World Health Organization. Just what I said really about the droplets. So it spreads mainly from person to person. So these droplets that are released when somebody who is ill sneezes or coughs, and then it lands on the mouths or noses of people who are nearby. Or if you have that close contact with somebody who is ill, like when you hug or you shake hands. Next slide, please. So it's mainly from person to person, as I said, but it can be left on objects and surfaces, hence why cleaning is so important, and in washing your hands. So the doorknobs, your light switches, your computer, your laptop, the mouse, the lift button, so it's frequently touched surfaces. Any digital device like pens, for example, if you think, oh, you go to a public place, you could I borrow a pen? So if you touch something that's contaminated and then you touch your face or somebody else's face without washing your hands after you've touched these surfaces or devices or objects, that's when you can get ill. Next slide, please. So to reduce your risk of COVID, so there's plenty of things you can do to reduce the risk and keep safe. A very important one is to clean your hands often and to avoid touching your eyes, nose, and mouth, which can be a bit difficult because we do it a lot of times without thinking. So if you wash your hands often, then that goes a long way to reduce this risk of you touching your eyes, nose, and mouth. And obviously avoiding close contact with somebody who is sick, which is also the social distancing. If you cough or sneeze, do it in your bent elbow, not on your hands, or you know, in a tissue. And to limit the social gatherings and the time spent in crowded places, and obviously follow the government rules. And as I said, really important, clean and disinfect frequently touched objects and surfaces. Next slide, please. So the general prevention measures is you're self-isolating, as Dr. Ghani has mentioned. Stay at home if you or a household member has COVID-19 symptoms. Use social distancing to reduce the spread of COVID. If you remember the droplets, so if you're close to somebody and they sneeze or cough, those droplets, so we need to keep the social distance of the 2 meters. The shielding to protect the extremely vulnerable in our society, the hand hygiene and the cough hygiene. So I will speak a bit more about those. Next one, please. So about keeping your distance, why do we do this? Why do we keep distance from others? It's because the risk of infection increases the closer you are to another person with the virus. So, and also the amount of time you spend in this close contact with them. However, saying that it's very unlikely to be infected if you just walk past somebody else on the street. And Public Health England recommends this distance, the 2 meters away from others, as a precaution. Obviously, these things might change. And the key thing, really, the key message is not to be too close to people for more than a short period of time, as much as you can. Next slide, please. With your hand hygiene, so it should be performed when you get to work, if you are working, when your hands are visibly soiled. So when your hands are visibly soiled, and we'll talk about that in a minute actually. So before and after you touch any equipment, and before handling food and drink, or if you do smoke or vape, make sure that you do your hand hygiene. And before leaving work, because you touch many objects. And alcohol gel is effective against COVID-19, as I said, at least 60% alcohol. But just as a little bit of a warning, there's been some fires in vehicles with alcohol gel, so please don't leave it in your cars. And if the hands are visibly dirty, you need to wash them with soap and water, because the alcohol gel won't be effective in that instance. And if you have any questions about that, I'm happy to answer those. Next slide, please. So this is just a poster. You might have seen this on social media or maybe places where you've been. It's just the steps for hand washing. What I will do is at the end of my presentation, we'll watch a very short video from the NHS on the steps for washing your hands. Next slide, please. This is just a quick image to show you that the bits that we actually most frequently forget to wash in our hands are the fingertips. So and then between the fingers, the back of the hands when we forget to do that, the thumbs, so when we forget to do that step, the wrists, don't forget the wrists, and then the wrinkles on your palms, so you need to make sure that you really lather with the soap and water. Next slide, please. About the catch it, pin it, kill it, and you might have seen this content as well on social media. It's your respiratory hygiene, your cough hygiene, and I briefly mentioned it already. Could I have the next slide, please? So about this one, so to avoid this direct hand contact with your eyes, nose, and mouth, you catch it with a tissue, and when you're coughing or sneezing, cover it with the disposable tissue and then dispose of it. So you bin it as soon as you can. And then to kill it, you wash your hands. So the catch it, bin it, kill is just a catchy phrase, and it's just really to help keep you safe. Next slide, please. About washing your clothes, I don't know if somebody has some queries or if they wondered, oh, what about my clothes? So there's some evidence that the virus can stay on fabrics for a few days, although usually it's shorter. But if you are working with people outside of your household, just wash your clothes regularly, obviously, according to your work patterns, etc. And changing clothes in the workplace should only be considered where there is a high risk of infection, or if there are highly vulnerable people, for example, a care home. And if you need to change your clothes, obviously avoid crowding into a changing room. Next slide, please. So testing, Dr. Ghani has spoken about it at length, but it is given all the details. Next slide, please. About face covering. So at the moment, you must wear a face covering at all times on public transport, when attending hospital as a visitor or outpatient. And if you can, you should also wear a face covering in other enclosed public spaces where the social distancing isn't possible and where you will come into contact with people you don't usually meet. So this is most relevant for short periods indoors in crowded areas. But evidence suggests that the face covering is not to protect you. It's if you are infected with the virus, but you don't yet have symptoms, then it may provide some protection for others that you come into close contact with. Next slide, please. So face coverings is just another protective measure, and they don't replace all the other measures. So it doesn't replace the social distancing. So you still have to keep your distance, even if you do wear a face covering. And if you have symptoms of COVID, obviously, you must isolate at home, and wearing a face covering doesn't change this. And you should still, arrange to have a test to see if you have COVID-19. Next slide, please. So the face covering is not the same as a surgical mask or a respirator. Those are used by healthcare, other workers, that it's part of their personal protective equipment. And they should continue to be reserved for those who need them to protect them against the risks they're exposed through their workplace. So health and care workers, people in industrial settings that are, for example, exposed to dust hazards. Face covering should also not be used by children under the age of 3 or anybody who may find it difficult to manage them correctly. There is some guidance online specifically about, who shouldn't wear them and who should. And the main thing, it's really important to use them properly and wash your hands before putting them on and taking them off. And you can make them at home, and there's some instructions online. We can also send you the link for that if you are interested in that. And the key thing is that it should cover the mouth and the nose. So if you wear the face covering just to cover the mouth, if you remember the droplets, and if the nose is not protected, then you are putting yourself at increased risk. So any face covering needs to cover the nose and the mouth. Next slide, please. So when at work, if you just need to follow the advice given to you by your employer, they will have risk assessed your workplace. They will have assessed and managed all the risks to your safety in the workplace. There has been guidance issued for employers and businesses on Covid-19. So things like adjustments to your workplace where you can keep social distancing from your colleagues, and about guidance on hygiene, for example. And usually the virus exists up to 72 hours on surfaces. So you will probably see as well more frequent cleaning, and you might be asked to do some of that, as in, for example, it might be that you have a wipe. So obviously that will be discussed with you through your employer. But you will see more frequent cleaning happen, particularly any communal surfaces, so door handles, the lift buttons, the bathrooms, the kitchen, things like that. Next slide, please. So always refer to the most up-to-date guidance, because it does change quite a lot. But in the gov.uk website, you always have the most up-to-date guidance, and obviously the NHS website, and in the Dudley Council site, there's also a wealth of information, and the email that will be provided. We're also happy to answer any questions. So we'll watch now that short video about the hand washing. So that's it from me. Thank you very much for your time.
Thank you, Claudia, and we'll move to Shaz.
Hi everyone, my name's Shaz and I'm from the charity Transforming Communities Together, and I head up the Near Neighbours programme across the Borough country. For those who aren't familiar with the Near Neighbours programme, we bring different faiths, ethnicities and diversities together in order to break barriers and build longer lasting friendships. Now today I've been asked to talk about how Near Neighbours have continued to connect with organisations and residents during this pandemic in compliance with the government guidance. So in the beginning of the lockdown, a lot of people struggled with the idea of staying home, and we saw people reacting to this in different ways. Having observed this, I began to communicate with residents and leads of organisations and find out how people were coping and what would make them feel a bit better. Now, these questions were asked to group leads and residents across the Black Country, not solely Dudley. Now, one keyword that kept on coming up was normality. And I learned very early on from asking these questions that all the residents really wanted was to have a bit of normality in their lives. And for example, one resident said she suffered from anxiety and really missed her exercise classes. And another said she just wanted to go shopping and have a coffee and cake with some friends. And these are just two of the examples that I had. Now, from this feedback, I had some work to do. And I began to look at creative ways of getting people together without physical social interaction. And in the beginning, it really felt impossible to do. But during this mapping period, I was invited to a Zoom conversation with some friends just to have a little catch up. I had such a good experience that soon after the Zoom conversation I had with my friends, I started to contact different organisations and I asked them whether they would like to partake in such conversations. Now, the organisations, and as we discussed some of the challenges that we could possibly face, one of those was the technology and downloading the Zoom app. And we knew this would be a barrier. So we helped residents download these apps and organisation leads helped their participants where it was needed. So using the Zoom platform, we have moved existing exercise classes online. Where possible, we've kept the same time and day, so residents were partaking in their regular class, but the difference was it was in the comfort of their own homes. We also supported organisations to move online. And in addition to these groups, we have also formed new groups online, which have created a space for some much needed conversations. And in these groups, a lot of conversations are happening about the pandemic and lockdown. And most recently, it's been moving towards post-COVID and current local issues. We've also had some fun sessions. Quiz nights was one of them, which was mirroring the pub-style quizzes and not forgetting the competitions online, which have been really popular amongst our children. And the list kind of goes on, to be honest with you. I've only been given a couple of minutes today. So on a final note, there is so much we can do during these unprecedented times whilst keeping ourselves and others safe. So if anyone would like to get in touch, I will leave my email and phone number on the chat. So please do contact me for more information on our online community groups, or if you have an idea of your own, I'll be more than happy to support you. Thank you.
Thank you, Shaz. We'll go across to Anne now, who will facilitate the questions with James Henderson. Over to you, Anne.
Hi, I'd just like to say thank you to all our speakers for such excellent presentations tonight. We have got several questions that have come through. Some of them have been answered in the little column at the side in the chat questions, but I think we might open those up a little bit more broadly as we go through. So James, I think you'd like to go first with questions.
Sure, yeah, thank you all. Nice to see you. The first question, I'm sorry, I've just lost it. I'll just be 1 second. Oh, somebody asked a really good question about where are the testing centres in Dudley?
Somebody on our panel like to comment?
Al, I think you answered it in the chat. Would you like to just explain to everyone your answer in the chat? That was very helpful.
That was Bal, I think. Shall I just say it in summary while Bal gets unmuted? that they don't release the information until you actually book the test, and then they're advising you where to go. And that's partly, I gather, because they're mobile centres. Val, did you want to come in there?
Thank you. Yes, I was muted. Sorry, I couldn't unmute myself. Yes, so yeah, we try not to sort of promote them, because it's not really one of, people assume they're drive-ins and they can just turn up. But if you book a test, you will be given the location.
Thank you. James, did you want to carry on with your questions?
Hi, yes, sorry. Can everyone hear me all right?
Yes.
Oh, lovely. Yes, the second question was about how people, especially elderly people, might be able to get food if they're shielding, and how that works within Dudley.
Thank you. I think we've already provided information. I've also put some a phone number as well. That phone number can be contacted. But I want to also mention that a number of our colleagues in the council have been contacting any members of public who are on the shielding list, and ensuring that whether they need any support or advice. But if there's anyone else who we feel that needs some support, I've already put some a phone number in the chat.
Oh, thank you so much. The next question was about what evidence do we have that people are gaining immunity once they've had the virus?
Shall I answer that? Yeah.
Yes, please do.
I think it is too early to actually know that how there are some obviously, so there's there are some reports of those antibody testing, and some frontline workers have that antibody testing. There's more research going on into that, but at this stage, we do not know how long the immunity can last. So the most important thing is maintaining those those measures which Claudia has gone through, hygiene, social distancing. This is the best way to protect ourselves, but also protect our families as well.
Lovely, thank you so much. There was also a similar question as well. Somebody was asking for the panel's thoughts on if social distancing was going to be reduced to 1 metre.
There's recently a review done, and I've put a link to the review as well, which is a really interestingly read to do that. I think the important thing here is that it's not just the physical distance which matter, but there are other factors as well, about the ventilation, and whether you're outside, whether you're inside, whether you are facing or not facing. But the advice is 2 meters if possible, and if not possible, in certain cases, it could be reduced. So that's what is calling 1 meter plus. But advice is to continue to do 2 meters if possible.
Lovely, thank you so much. And then, Bal, I think in your talk, you mentioned about a couple of surveys, one about a school behavioural survey, and one about a population survey, and a couple of people were wanting to know a little bit more about both of those, if that's possible.
Yes, of course. We're just in the we're just at the moment pulling together a population survey. So it's primarily going to be looking at a wide range of sort of factors to get an understanding of the impact that COVID-19 has had on the population. And so what it will include is, and I've actually got I've got some of a summary here actually. So what we're thinking of doing is sending it out sometime in the next couple of weeks, and it will look at it'll be targeted at individuals, families, a whole raft of people in the borough, and it will ask about your background, and we get a bit of an understanding of what the impact the lockdown measures have had on your various aspects of your health and well-being, such as mental health, physical health, your employment, your relationships. We're trying to keep it as short as possible, but obviously, you know, we're going to try and capture whatever, you know, as broad a data as we can. We know from other areas that it's actually, a lot of people have been very receptive, that people have wanted to share the impact of COVID-19. So we really want to take advantage of that, because that will really help us understand what the impact has been for our residents in Dudley in particular, and it helps shape some of the programmes going forward for us, and ensure we're actually reaching those communities and groups that have had different experiences, and addressing those going forward. And then, the second one is the school survey. So we normally undertake a school survey every 2 years, and it's very popular. We get a very high percentage uptake because we actually undertake it in the school setting. So children are actually given the time, they sit almost in exam-like settings, and they all participate. And we find that survey is very helpful. So what we wanted to do this year was commission one to go out in September, October time, based on the school sort of timetable, because now we know that the schools are going back fully in September. And again, that will give us a snapshot of what experiences young people have had, but it will also enable us to compare that with previous data we've got as well, to see whether the trends and experiences have changed. And I think we're particularly interested in the survey does cover the emotional health and well-being aspects, and I know we've heard a lot in the media about the impact it's having on people's mental well-being. So again, it'll give us an understanding of you know, because we're using a specific tool, it'll help us understand in more deep depth what that impact has been for our young people as well.
Thanks for that, Val. Thinking more a little bit about some of the data that you were sharing earlier on this evening, I wonder if you'd be able to give us a little bit more information on whether the question is whether the percentage of COVID-19 deaths have been broken down by ethnicity for Dudley. I think you're on mute, Val. Sorry.
There you go.
That's good.
Yes, we are doing some work on that, and I think you know, part of it's going to be aligned to the mortality review. So as soon as we've got that data, you know, what we can make publicly available, we will do. I think, you know, the national, I've said in the notes, obviously the national report that was published identified the lack of sort of data and the timeliness of data that would help us prepare and respond to any particular concerns that are rising. So I think there's going to probably, hopefully, be nationally and locally more emphasis on the fact that we need to be capturing ethnicity data, but you know, in terms of helping us monitor the programs, the reach it's having. So I think it's a really important question to ask.
So, and that's a really good thing for everybody to be contributing to filling in whenever we're asked, be that when we go to the doctor or the dentist or any other educational setting or anywhere that we're asked for that data. Yeah, thank you. You mentioned that there's a BAME subgroup to the Health and Wellbeing Board, Val. Could you tell us a little bit more about that? Is that something that's recently been established, or? And who sits on it possibly?
Okay, so we've because a lot of meetings and business as usual had sort of stopped because of the COVID-19 response. We have only had a meeting this week of the Health and Wellbeing Board, and as I said, that is a very system-wide board. It's made of representatives across across health, social care, voluntary community sector. So we've formally agreed that all of the work that we're doing, so it doesn't mean that the work stopped, but that all of the work that we're doing around this particular agenda will sit under that strategic board. So it gives it more sort of a higher priority as well. The membership is going to be we are going to look at the membership, and I know that a number of people have asked about that, and we would want to make sure that it is as inclusive as possible. So if people are interested, if they put themselves forward, it will primarily be led by public health in partnership with the voluntary community sector.
So that sounds as though it could be an opportunity for people to volunteer. There are other questions in the chat room. I think some of them will actually be answered in subsequent sessions. Some of them relate to emotional health and well-being, and we have a session there on the 24th of July. And some of them relate to financial matters and workplace matters with risk assessments, and they are both down on the programme for the 31st of July. So at that point, I think our time is up, and I'll hand back over to Jackie to give formal thanks at the end of our evening. Thank you.
Okay, thank you, Anne. Yes, I just wanted to thank everyone. I think at this point,